Here is your question. Right, so if you have read and understood, considering it surgical anatomy station, kindly please tell me if you can recognize, or if you can tell me how would you divide the triangles of the neck?
The triangles of the neck is divided into anterior triangle and posterior triangle.
Yes.
By
yes.
the sternocleidomastoid muscle, basically. The
Okay.
anterior triangle is bounded behind by the anterior margin of sternocleidomastoid, above by the margin of mandible, and in front by midline. And posterior triangle is again bounded anteriorly by the posterior margin of sternocleidomastoid muscle, behind by the anterior margin of trapezius, and below by middle third of
all right. Thank you. Can you please tell me these anterior triangles are further divided into how many triangles, and what are their boundaries, please?
They're again divided into 4 triangles: submental, submandibular, carotid, and muscular triangle.
Right, good. Can you, if we begin from 1 here, would you be able to identify which muscle is this, please?
This is the posterior belly of digastric.
Very good. Number 2, can you identify which triangle or which space is this?
This is the carotid triangle.
Good. If you can identify number 3, which triangle could that be?
This is part of posterior triangle, the occipital triangle.
Number 4, if you can identify.
Sternocleidomastoid.
Very good. It has how many ends? If you can tell me the origin and insertion of this muscle, please.
This has clavicular and sternal head.
Very good.
That's the origin. And insertion into the mastoid process.
If you don't remember, we can come back to that later. Okay. Can you please, we can move on, and can you identify number 5, please? Which structure is
inferior belly of omohyoid.
Very good. 6, please.
6 is the trapezius.
Very good. 7 is this space over here. Can you identify, please?
Supraclavicular triangle.
Very good. 8 is this space
muscular
over here.
Triangle.
Very good. 9 is this muscle. Can you identify?
Superior belly of omohyoid.
Very good. Number 10 is this structure. Can you identify? Very good. 11 is this.
Anterior belly of digastric.
Very good. 12 is this. If you can identify.
This is submandibular triangle.
Very good. And
Digastric triangle.
Yes, 13 is digastric.
13 is the digastric triangle.
Can you please tell me the contents of the posterior triangle, please?
Posterior triangle contents are among the nerves. There is the 3 roots of brachial plexus, superficial branches of cervical plexus, and mainly the spinal accessory nerve, and also phrenic nerve. And among the vessels, third part of subclavian artery, external jugular vein, and among the muscles, there are the scalene muscles, and also inferior belly of omohyoid, and also supraclavicular lymph nodes and occipital lymph nodes.
Okay. Right. Can you please tell me what is the most common contents of the anterior triangle?
Anterior triangle.
Yes, please.
according to division, the digestive triangle contains submandibular
Yes.
gland, submandibular lymph nodes, facial vessels, and hypoglossal nerve.
Yes.
The submental triangle contains the submental lymph nodes, sublingual glands, and the muscular triangle contains the strap muscles and extrajugular vein. The carotid triangle contains the common carotid along with internal carotid artery, interjugular vein, vagus nerve, and ansa cervicalis.
Very good. Okay. If you can identify which organ or which structure could this be?
This is the thyroid gland.
Yes. So what are you looking at? Dissection of or anterior dissection of neck?
This is the coronal section of
the neck.
root
Okay.
of the neck.
Root of the neck. Very good. So this is thyroid gland. So which structure could this be? Number G?
Number G is the inferior thyroid artery.
Okay. If I ask you to tell me or describe the parts of the thyroid gland, can you please do it?
There is isthmus and
Yes.
two
Which
lateral
is number
lobes.
E. Yes.
Two
And
lateral
behind,
lobes,
yes,
and
behind,
sometimes
yes, behind
there are
thyroid gland is,
pyramidal lobes. Behind thyroid gland, there are parathyroid glands.
how many are they in number?
There are 4 in number.
Okay, good. Can you tell me the blood supply of the thyroid gland, please?
Superior thyroid artery and inferior thyroid artery,
Yes.
and sometimes artery thyroidema. Superior thyroid artery um, from external carotid artery,
Yes.
and inferior thyroid artery from the thyrocervical trunk of subclavian artery,
Yes.
and artery
And the
thyroid
venous
artery
drainage?
thyroidema from
Yes.
brachiocephalic.
And the venous
Venous
drainage?
drainage,
Yes.
superior and medial thyroid veins draining into extrajugular, draining into interjugular vein, and inferior thyroid vein into brachiocephalic vein.
Brachus, very good. The lymphatic drainage of the thyroid gland, please, occurs where? Quickly, if you can tell me.
Into pretracheal and paratracheal lymph nodes.
Very good. And the nerve supply of thyroid is by which nerve?
Sympathetic and parasympathetic
Okay.
nerves, recurrent laryngeal and superior laryngeal nerve.
Okay. And the recurrent laryngeal nerve supplies all the muscles except
All the muscles of
the
larynx
larynx.
except
Yes.
the cricothyroid, which is supplied by
Yes.
superior laryngeal nerve.
Can you please tell me during thyroidectomy, which nerve is most likely at risk of injury?
Recurrent laryngeal nerve is mostly at risk of injury at
Yes. Why?
the lower pole.
Okay.
Along the relation with the
Yes.
inferior thyroid vessel.
Tell me, please, the embryology of thyroid gland. How the thyroglosal cyst is formed?
Thyroid gland, embryologically develops at the level of tongue,
Foramen cecum.
at the level of foramen cecum,
Yes.
and then it descends into its position along the pathway,
Yes.
which if doesn't close,
Yes.
it forms the thyroglossal cyst.
Okay. Then it forms the thyroglosal cyst. Okay. Can you please tell me the thyroid cartilage is found at what level? Vertebral level?
Cervical 4.
Between C and 4. Okay.
Between
Can
C
you,
and 4.
all right, you kind of told me, but I want you to explain why the thyroid moves during deglutition.
Because it's enclosed by pretracheal fascia,
Yes.
and also to the tracheal rings by ligament of Berry, and that's why it moves along with deglutition due to movement of hyoid bone and thyroid cartilage.
Right. Can you tell me what is the most common type of thyroid cancer which spreads lymphatically?
Papillary carcinoma.
Very good. What are the complications of thyroidectomy?
Complications, there may be immediate and late complications.
Very good.
Immediate complications like bleeding,
Hematoma,
reactionary
yes.
hemorrhage,
Yes. Yes. Yes.
bleeding, hematoma,
Yes.
and respiratory obstruction
Difficulty
due to
or yes,
hematoma,
yes,
difficulty. And late complications, there may be parathyroid gland excision along with thyroid gland, and that may result in hypocalcemia.
yes. Good. And the late
And
complication.
also nerve injury is the
Yes. So nerve injury is also one of them. All right, good. We probably have one more image. Yes, if you can tell me which vessel is this red one.
this is the internal carotid.
Okay, good.
Sorry.
And if you can, yes, please tell me the landmark of this blue structure 11. The surface marking.
11 is
It's a yes.
internal jugular vein.
Okay.
No,
So
external jugular vein.
external jugular vein. So if you can tell me the surface marking of it, please.
External jugular vein.
From the earlobe, yes, because here it's starting, if you could see.
It starts as a common facial vein and retromandibular vein.
Okay.
The anterodivision of retromandibular vein joins with the facial vein to form the common trunk.
Yes.
And drains into external jugular vein, and this further drains into the subclavian vein.
Okay, when surface marking is asked, then you have to tell me in relation to the surface structures that you can see. So with the blind eye, you can outline the whole structure on the skin of a patient or a person. So that is the surface marking. You can read again from where to where it is the straight line or whatever. So you can tell me properly next time. Thank you. Good.